The beginnings of general anesthesia. Surgery prior to general anesthesia was both horrific and dangerous. Early anesthetics were called soporifics. A soporific dulls the senses and produces sleep. Narcotics were also used to help relieve pain. The ancient Romans used opium and a variety of plants that contained potent alkaloids, such as jimson weed, marijuana, and belladonna. Other early techniques included alcohol, acupuncture, ice, and hypnosis. Ancient Incas produced a local anesthetic effect by chewing cocoa leaves and spitting into the wound. By the middle of the 19th century, two agents most often used were alcohol and opiates. Both had serious side effects, and neither had the desired outcome of completely alleviating pain. A Swiss physician named Paracelsus used a flammable chemical liquid called sweet vitriol on chickens. He reported that when the chickens breathed the gas, they not only fell asleep, they felt no pain. In 1730, a German chemist named Frobenius gave the liquid the name we know it by today, ether. The word ether is taken from the Greek, meaning pure air. In 1772, Joseph Priestley discovered the gas nitrous oxide and described how to produce it. A few years later, in Bristol, England, a chemist named Humphrey Davy discovered that inhaling nitrous oxide made him laugh, and so he called it laughing gas. By the early 19th century, laughing gas parties were commonplace. In December of 1844, a Hartford, Connecticut dentist named Horace Wells went to a public demonstration of nitrous oxide when he witnessed a participant injure his knee and felt no pain. Wells thought of the potential anesthetic use of the gas. Then he persuaded a colleague to pull one of his teeth while he was breathing nitrous oxide, and he too experienced no pain. Wells then traveled to Boston to describe his discovery to a former student of his, William Morton. Morton convinced the famous Massachusetts General Hospital surgeon, John Collins Warren, to try surgery with the use of inhalational nitrous oxide as an anesthetic. In January of 1845, Wells administered nitrous oxide for Warren as he operated on a schoolboy in front of a Harvard Medical School class. The boy cried out in pain, and Warren called nitrous oxide a humbug, and Wells was forever disgraced. Then, Charles Jackson, a dentist and former classmate of Morton, suggested that sulfuric ether be used instead of nitrous oxide. And on October 16, 1846, in a surgical amphitheater now called the Ether Dome at the Massachusetts General Hospital in Boston, John Collins Warren removed a tumor from the jaw of Edward Abbott, and the patient had no pain nor any memory of the operation. And Warren declared, "Gentlemen, this is no humbug," and the modern era of surgery had begun. Wells, Jackson, and Morton each claimed to be the inventor of general anesthesia. Wells, disgraced by his failure, went on to give up dentistry and became a traveling salesman. He soon became addicted to chloroform. He then went to alcohol, and in New York City, while intoxicated by both, threw sulfuric ether on two prostitutes. He was arrested and jailed, and while in jail, he committed suicide. Morton read an article in the Atlantic Journal that supported Jackson as the inventor of anesthesia. He became so upset that he had a stroke and died. Jackson, after visiting Morton's gravesite, where he read the headstone that proclaimed Morton to be the inventor of anesthesia, went insane and had to be institutionalized for the remaining 7 years of his life. Crawford Williamson Long was born on November 1, 1815, in Danielsville, Georgia. He was the son of a wealthy merchant and cousin of the infamous John Henry Doc Holliday. At a young age of 14, he entered the University of Georgia in Athens, Georgia. There, his roommate was Alexander Stephens, the future vice president of the Confederacy during the Civil War. After graduating in 1835, he started his medical education at Transylvania College in Lexington, Kentucky, but left after 1 year, transferring to the University of Pennsylvania in Philadelphia. It was there he obtained his medical degree in 1839. In 1841, after a hospital internship in New York City, Long returned to Jefferson, Georgia, to begin his practice of medicine and surgery. During his medical school years, Long had seen laughing gas parties and ether frolics and noticed that those who would inhale laughing gas or sulfuric ether felt no pain until the effects of the gas were gone. He performed his first surgical procedure using sulfuric ether on March 30th, 1842, when he excised a tumor from the neck of a young man. Long continued to use sulfuric ether as an anesthetic, but did not publish his efforts. Long read about William Martin, who used sulfuric ether as an anesthetic, which prompted him, Long, to publish his use of it in the Southern Medical and Surgical Journal in 1849. Although he used several years ahead of the others in Boston, Long would not get full credit for this major advance in surgery until after his death. In 1851, Long and his wife Carolyn moved to Athens, Georgia, where he joined his brother Robert in practice. During the Civil War, he remained in Athens and treated both Union and Confederate soldiers. He died in Athens, Georgia on June 16, 1878. Although William Morton is well known for his role in the discovery of anesthesia on October 16, 1846 in Boston, Crawford Long was the first to have used ether-based anesthesia. Long is now recognized by medical societies worldwide and has been remembered in many ways, including monuments, statues, and a U.S. postage stamp. In 1931, the Davis Fisher Sanatorium on Linden Avenue in Atlanta, Georgia, was renamed Crawford W. Long Memorial Hospital in honor of Dr. Long. In February of 2009, the 500-bed teaching hospital was renamed Emory University Hospital Midtown. But the original name is maintained on its exterior monuments. A statue of Dr. Crawford Long stands in the United States Capitol as one of the two monuments representing the state of Georgia. Doctor's Day is March 30th. It was March 30th, 1842 when Crawford Long used general anesthesia for the first time. Doctor's Day was first celebrated in 1932 in Georgia. Then in 1958, the United States House of Representatives adopted a resolution commemorating Doctor's Day, and in 1990, President George Bush signed into public law designated March 30th as National Doctor's Day.